Okay, so that's 10 o'clock, and we can start the meeting. Just before I begin, I noticed that Christina Cooper is going to be joining us in a wee minute because I think she's having some technical issues. Just wanted to say that I'm pleased to see that we have some guests here today to observe the meeting, and I'm sure you all know the protocol, but just to remind those who are here as guests that it's only IJB members who can speak at this meeting today and ask questions. But so just had to be said. But I really appreciate your attendance today. Arlene, over to you.
Thank you. Can I just remind everybody that the meeting is being recorded and will be placed on websites for public viewing. And I'll now take a roll call for the minute. Councillor Lynn.
Present.
Bob Benson.
Present.
Councillor Toland. Councillor McHugh.
Sorry,
Present.
I'm so sorry. I'm here. I just couldn't have catch the thingy. I'm here. Sorry.
Councillor McHugh.
Present.
David Cheap.
Present.
Colleen Carlton. Glenn Lloyd.
Present.
Oh, thanks, Glenn. Dave Berry.
Present.
Christine Jones. Present. David Wilson.
Present, Arlene, thanks.
Susie Brown.
Present.
Sanjay Pillai. Rima Marshall.
Present.
Jim McFarlane.
Morning, Arlene, I'm here.
Christina Cooper. Yeah.
Yeah, she's here.
Martin Sloan.
Present.
Emma Fletcher. David Shaw. Okay, so that concludes the roll call. Yeah, we'll just carry on with the agenda.
Yep.
So item 1, there haven't been any apologies noted, but I'll note the ones of the people who are not here. Item 2, declaration of interest. Are there any declarations? Not seeing any declarations, so that takes us on to item 3, Accounts Commission IJB Finance Bulletin 2022-24. This is for noting.
So yeah, this is a summary of the recent Accounts Commission Finance Bulletin, which we thought it would be useful to include in today's agenda to provide a kind of background to the Scotland-wide position, provide some context for our own budget setting process. Dave, over to you, please.
Yes, that's Chair. So as you said, it gives a good kind of background and to get an overview of the national position when it comes to integration joint reports and finances. So as you say, this is the an Accounts Commission report. It is based on the 23-24 kind of findings. So this is kind of based on the year-end position that what Scotland have gathered from the accounts for the IGBs for 23-24. But as always, what Scotland will always kind of take a look forward and kind of look at some of the challenges ahead. I think when we kind of go through each of the findings and key messages there, it resonates with our own position within Dundee in terms of those challenges again as IGB. We've discussed these numerous times throughout our kind of various governance meetings. So there's a kind of theme around the financial sustainability of IGBs with funding gap in 24-25, i.e. the current financial year identified of over £457 million. The latest figure that we're kind of working to nationally is kind of based on everybody going through the same process as we are doing today, is a £560 million gap for IGBs for 25-26. So you can see that continued kind of financial pressure that's around integration joint reports. That coupled with a significant reduction on the level of reserves that IJBs hold kind of gives us a real challenge around our financial sustainability across the country. And you can see there in terms of the kind of findings, key messages of the big page 9 of the report. That the reserves held by IJBs are reduced by 40% in 23-24. Contingency reserves almost half. When we kind of do the reflection back on the 24-25 position, that will be a kind of further reduction in that position in terms of IJBs that still retain reserves. A number of kind of key elements in terms of what we would want to kind of take forward. So kind of on page 10 of the report, bullet point number 6, and it is things that we've reflected within our kind of current 25-26 budget proposals. It's kind of that collaborative working with our partner bodies within NHS and the council around transformation. What we need to do around investment in early prevention. So that's a kind of winder than everything that we can do, and improve that experience and outcomes for people. So there's quite we've kind of found that to be kind of really helpful contextual report for IJB members. And we're obviously going to dive into the detail of everything that's in there because there's a lot of kind of statistics and information that's there, but happy to open up for any questions or comments on that particular report.
It certainly paints a stark picture of the Scotland-wide situation. Now, can I just say at this point, Dave, and I just want to see, right, no hands up in the room. I think David Cheap, your hand just went up there. Or did you take it down again, David?
No, it is up.
Still up. Yeah.
Morning, Ken. Thanks very much. It's just a very introductory. I think it's a good. This is a good review document to start the process today. I think it's essential really for everybody to actually see the situation that IJBs all around Scotland are facing, and that there's commonality across so much of that. And the challenges that are there for us, we've been through that through our workshops. We know what we're facing here, but I think one of the statements in the review says it all really, that we're here to the goal is to provide high quality care while managing our costs, and that's what we have to do, and keep that in mind when we're doing this budget. We have to manage costs, but at the same time provide the best quality care we can within a balanced budget. And I'll leave it at that. Thanks.
Yeah, thanks, David. And certainly given the pressures that we've had in the last year, it's not an easy task, but it's certainly one that we need to stick to. Dorothy, make sure you're next.
Thanks, Ken. Yes, as you already said, a sobering report from the Accounts Commission, and the key messages highlight a very difficult road ahead, and the projected financial position set to worsen, as Dave's just updated us on. Two key areas of the report jumped out at me. Firstly, 9 years on from our foundation in 2016, the Accounts Commission finds it necessary to emphasise the need for us to work together with our partners. The context around this is that collaborative working will allow us to better transform services so that they are affordable and will improve the experience and outcomes for people. So perhaps it's now the time to reflect on how our integration model actually works in practice. I would appreciate Officer's view on how best this could be done. The second area I want to highlight is the warning in the Accounts Commission introduction that demographic shifts are driving increased demand. We all know this. And I would ask you all to keep this in the forefront of your mind when considering the budget proposals further down the agenda.
Thank you, Dorothy. I think certainly that's something we can be looking at over the coming year. Dave, did you want to come in on that? Particularly the question about, maybe a closer look at how integration is working, certainly locally and a more national view. Is that something we can be looking at over the next year?
So yeah, no, and thanks for the questions, Councillor McHugh. So in terms of the collaborative working side of things. There's quite a lot of work being undertaken with our kind of partner, our statutory partners around continuing to improve how integration works. And it's not just the council and NHS Tayside, it's also our kind of fellow IJBs within Tayside, and kind of looking at how we, for instance, manage the lead partner arrangements better, because we think we identified that that's probably a bit of a weakness that we need to develop in terms of governance and accountability. So we're taking forward a lot of work around that. I think if you see what comes from NHS Tayside's kind of looking at the planning over 25, 26 and beyond, you'll see much more of a resonance between the acute side of things and kind of whole system approaches, and indeed things like that we're considered as part of an IJB, such as palliative care, are going to feature kind of quite highly in terms of prominence within an NHS Tayside context. So I've been here since the start of integration, and I've probably seen a bit more of a kind of focus on that kind of collaborative, or being more open to kind of collaborative working around some of these challenges. So I'm kind of hopeful that we can harness that as we move in through 25, 26 onwards.
It's certainly worth doing if we can provide at least as good and hopefully better service. Why not work as collaboratively? Sorry, I'm trouble with that word. Collaboratively as possible. Yeah, absolutely. I don't see any hands in the room. Oh yeah, Jim McFarlane.
Yeah, thanks, Ken. And look, I understand what's coming from the Accounts Commission and reading their stuff, but it somewhat really jars with me, because it's talking about, like you're saying, being efficient, being effective. When, we've had 15 or 16 years of this, right? Some of those services that we're now looking at either paring back or reducing and stuff like that, they exist because there's a need for them. I get that this isn't a criticism of any of the officers or anything like that, drawing this up. I get that what your remit is here, but there's a whole issue here. If there's a demographic changes, the increase in need for those services, expected to deliver that with less and less resources year upon year upon year, and you can put as much as you want into the kind of collaborative work, and I don't think any of the frontline staff are opposed to that, or even the increased use or better development of technology and how we use that and stuff like that. But sometimes that needs investment. And another thing that really jars with me is about stuff about the increasing need for training and development of staff. Yet there is no mention at all about the levels of pay and terms and conditions of the workforce across this whole sector, both in the NHS, the council, and the wider voluntary and third sector and stuff like that. How can you deliver on that? When we have recruitment and retention issues on that again, and even the Scottish Government's own research has shown time and time again around, if we pay staff more, you'll have less and less recruitment and retention issues. So, I get why we're here today and what we've got to do in the sense of, setting a budget and the legalities of that. But something we need is, when does it change? They'll only stop chasing us for cuts, when we stop running away from them, But sometimes the politicians need to make a stand on this and really have some investment into the side of the service. It's becoming really, really frustrating, particularly for the staff on the front line to read some of this stuff, to hear it, and being lectured as if they've got to be more efficient and stuff like that, when reality some of them are on their knees, and that's it. So I know I'm coming across as really frustrated, but that's partly because it's really, really difficult out there for the service, but also for the communities that we live in, work in, and that your workforce provides it, a service to and stuff like that. So, something needs to change.
Thanks for that, Jim. I've certainly made representations to other politicians that are a lot higher up the chain than myself in terms of issue on finances, specifically here in Dundee, because our performance over the last year has actually been very good, but it's more and more difficult to maintain, as you say, without the increase in resources that we would need to go forward in the way that we have in the last few years. Dorothy.
I just wanted to come back if I can, on following Dave's comments in response to my question. Considering the comments that the Accounts Commission have made regarding how integration is working, not just in our area but across Scotland, I wonder if we could have at some stage in the future a report, highlighting perhaps what we do well and where the weaknesses lie, that Dave identified in terms of governance and accountability. I think that would be very useful.
I'm sure Dave would be happy to do that, Dave.
Yeah, we're doing some work on it with lead partner kind of arrangements in particular, so that might be a good starting point once we complete that work to bring back. So Bob's got his hand up, Chair.
Yep.
If I may, Ken, just further to what Dorothy was just saying there, I think clearly there's a role for Policy and Audit Committee in this, and I think that I know is enshrined within the paperwork further down the line. So I think it's important that we use those powers that we already have to do that scrutiny around accountability, etc.
Absolutely, thanks for that, Bob. I see no other hands, and this item is for noting. So can we move on to the next item, please?
That takes us on to item 4, Dundee Integration Joint Board Proposed Budget 2025-2026. You're asked to agree the recommendations.
So clearly there's a lot of paperwork here, as there should be, if you include the results of the budget consultation, which we carried out for the first time this year. A lot of work went into that, and it certainly had an impact, I think, on the decision-making process, which has led to this proposed budget today. So I don't know who's going to have the really onerous task of speaking to this, Dave. I think Christine's hand is up. A lot to cover here, Christine. So yeah.
Okay, thank you. Okay, thanks for that, Chair. So as we just heard, we just discussed the financial position for the IJBs across the country is extremely challenging, and position faced by Dundee IJB during 24-25 and going into 25-26 clearly mirrors this. During the last 4 months or so, we as officers have worked alongside IJB members through both the forum meetings that we've had, the reports that we've had, and the development sessions to discuss and progress plans to allow us to present a balanced budget proposal to you today. The scale and the potential implications of the budget challenge this year has been unprecedented, given the IJB's 9-10-year history. But we as officers have a duty to present a balanced budget proposal to you, and we've taken this responsibility very seriously, particularly in terms of understanding and mitigating the impact of proposals on our population, and given the comments and the feedback in the Accounts Commission report as well, obviously mirrors that type of thing. I'm pleased to be able to present a balanced budget paper to you today, along with various appendices, which is that culmination of all the work and the progress that we've made over the last few months. And this is presented for decision. I've just got a few minutes, if that's all right, just to take you through a few key sections and points of the paper. So through section 4, the paper details the additional funding that IJB expects to receive from both NHS Tayside and Dundee City Council to support the 25-26 position. Both organisations have indicated continuation of existing delegated funding levels, plus the uplift as detailed in sections 4.2 and 4.4 respectively. It's recommended that the IJB confirms acceptance of the delegated budget from Dundee City Council, and also notes the indicative funding from NHS Tayside pending approval of their budget next month. Additional funding totals 9.623 million, and as detailed and broken down in section 4.9, the IJB's delegated budget for 25-26 is expected to be just over £320 million, which will utilise to support the community health and social care needs of adults across the city, in line with the strategic plan. Section 4.5 details the anticipated additional cost pressures and investment proposals that the IJB's delegated budgets are expected to be faced with. This totals £27.171 million of additional cost pressures. These cost pressures have arisen from growing demand and complexity of care, as well as an increased cost base as a result of pay uplift and employers' national insurance implications. Section 4.6 highlights the pay uplift for staff working in adult social care, particularly with our external providers, with an uplift from April to at least £12.60 per hour. Additional Scottish Government funding has been provided to support this, and the IJB is asked to approve the increased contract payments to other party commission services to facilitate this. Section 4.10 summarises the consultation process and feedback, and all the responses have been noted and go together in the report in Appendix 4. The feedback has helped to shape and finalise the proposals presented today, along with the information that's contained in the various integrated impact assessments as well. The net cost pressures for Dundee IJB in 25-26 is therefore 17.548 million. And Appendices 2 and 3 provide a breakdown of the actions that are planned and proposed to mitigate this shortfall. Appendix 2 details the operational efficiencies and actions that within the delegated authority of management to determine, while Appendix 3 provides details of savings proposals that the IJB are asked to approve to enable officers to progress. Appendices 6 to 12 then provides more detail on these proposals, along with the integrated impact assessments for these, to support the IJB members to make informed decisions. These papers are a culmination of a lot of hard work over recent months, and I'd just like to thank colleagues in the finance team, strategic services and performance teams, and across operational services for all the support to get us to where we are today. Also thanks to partners in NHS, Dundee City Council and neighbouring health and social care partnerships for ongoing support towards collaborative working. And finally, to you as IJB members for your engagement and your robust questions through the development sessions that we've had. While this paper is presented for proposal, as a proposal and recommendation for approval, there is one update that I'd just like to add on verbally to the position, just to highlight that we are continuing to work with our partners in NHS Tayside, Dundee City Council and Scottish Government. So from NHS Tayside Director of Finance yesterday, I've had a verbal advice that NHS Tayside will be adding the 40% funding gap for the ENICs to us in 25-26 on a non-recurring basis at the moment. That adds an extra £670,000 of funding into our position. So once we get that confirmed, then I would be proposing that we actually adjust the efficiency target, the £3 million efficiency target, from 1.5 down to 1.2 to reflect that additional funding that we've got in. And just to highlight that we do have additional conversations still ongoing with NHS Tayside and the Scottish Government for some potential additional funding opportunities that are out there. I'll bring that back as and when we get sort of confirmation of that, hopefully to the April IJB meeting, and an update on that one. So happy to pick up any questions, and this paper is presented for approval from the board.
Well, yeah, thanks very much for that, and I echo absolutely what you've said about all the hard work that's gone into presenting a balanced budget, which has been no easy task. And not just in terms of that, the work itself, but the toll that it takes on you when you're trying to consider how best to spend scant resources in the most. Yeah, I'll bring you in next, Bob, in the most appropriate areas. I think one of the bright spots, I have to say, in this budget today is the fact that we're seeing a further uplift in the minimum wage paid to care workers of it's now £12.60 an hour, and whilst not a fortune by any means, and doesn't, I think, even now reflect the value of the work that care workers do, it's to be welcomed, and it's certainly well in excess of the living wage in England, which I think is now £12.21. Really pleased to hear that there's some extra monies coming from NHS Tayside in terms of the employer's national insurance contributions increase, which is, to be honest, an additional burden this year, which we did not need. So that's to be welcomed. My only other question, and I think I know what the answer is here, in Table 4, our budget balancing proposals, clearly Dundee City Council have already had their budget meeting. The NHS Tayside budget uplift is an anticipated one. Now, I'm sure that discussions have been ongoing about that, and that anticipated figure is likely to reflect the final sum that we receive. Just maybe looking for some reassurance on that, please?
No, that's the figures. They're passing on the additional funding that they're receiving in proportion to our budgets. We have that verbal advice, and we will bring back a paper in probably the June meeting should anything change. But we will probably, by the April meeting, we'll probably have sight of their draft paper. So they'll see if there's anything that's changed by our April meeting, and I'll highlight it at that point and bring back confirmation in June.
You don't anticipate it being very far away from the 5433 figure? No.
That's the information that they've shared.
That's what I thought, to be honest. Just look for assurance on that. But can I bring in Bob Benson, please?
Thank you so much indeed. Thank you. It's also very good news to hear about the feedback from NHS Tayside, from the Director of Finance. That's very heartening indeed. I have two questions, Ken. One is on the consultation, which I would like Dave Ferry to pick up on, and one from Christine. I think the consultation exercise has been really well done. I think there's a lot of good work done on this. A lot of hard work has gone into this. However, I think there are some lessons learned from this exercise that has come to light since the end of the consultation period. And I think we have to think about consultation being in a fan Tayside, because there are other IJVs in Tayside who are affected by these changes. So we should have picked up on that. So that's one key lesson learned from this. I think there's also another one, which is to do with staff workforce changes, particularly withdrawal of commission services or potential withdrawal of commission services in certain areas. And that requires some fairly early heads up on that before these matters become public. And I think that equally applies to both the main funders around NHS Tayside and the Council indeed, about early engagement. And these have been comments that have been made to me about a need for much earlier engagement with these issues around the implications for staff. So I would like to see a lessons learned review paper come to a future IJV that we can go through what we can learn from this exercise, which we don't do that frequently, but it's worth us doing this anyway. And my second question is really to do with the budgets and about anticipated cost pressures on the delegated IJV budgets. And there are two areas that I noticed where there have been quite large shifts since the recent budget iterations, particularly around the increase to commission services and provision for demographic pressures. There have been quite large changes there. That makes me feel uncomfortable when I'm looking at those large shifts from previous iterations, and I wondered if both Dave and Christine could respond to both of these questions.
Dave.
Okay, thanks for that. Thanks for the question, Bob. So in terms of the consultation, as you can already point out, so this is the first time that we've actually carried out any form of consultation in that way. I think overall it's been relatively successful. We did have a really good response rate, given the kind of relatively restricted time period that we had to develop and deliver that. And we've incorporated, as you can see within the report, a kind of full kind of overview of what that kind of budget consultation told us, and indeed has also kind of helped shape a number of the proposals that are within there. So there's absolute kind of value in us continuing to kind of take that approach in future. We've kind of reflected quite a bit on some of the approach that's been made, so I absolutely agree there are quite a number of lessons to be learned around the kind of approach that we've taken. So ourselves as officers will do that kind of reflection, and I'm happy to bring forward a kind of future report on how we want to do that in future. I think one of the key things for me is around bringing that earlier in the process, which is quite a challenge for us in the IJB, because we really don't know. We're kind of almost last in the chain in terms of budget decisions to determine what the kind of scale of gap is that we're going to be facing. But I think there's something that we can bring in earlier in our process around some general kind of themes and messages around our budget that we could seek the public's and other stakeholders' views on. So I'm happy to make that commitment, and we'll come back in due course. And just picking up on the staff engagement side of things. So yeah, again, there's been a few lessons learned from the approach this year around how we can undertake that staff engagement, as you say, much earlier in the process. And again, that's a bit of a learning experience for us. So happy to take these away as good lessons learned for the future.
You happy with that, Bob?
If we can agree that we can have a review paper on this at a future IJB, Ken?
Yep, I'd be happy to agree that. Absolutely, yep. And no other hands in the room, I don't believe. So next is Dorothy, please.
Please start and indicate that you wish to speak.
Sorry, who has?
Colin.
Colin, yes, Colin. I'll take
My second question is to Christy. That's still to the board.
Yeah, if that's what I'll pick up with your second point in terms of changes
sorry, yeah.
The changes in the numbers and the iteration of that through the last few months. Yeah, as we start the process relatively early with limited information at the start of sort of November through October, November, we will continue to sort of refine and analyse our assumptions and the information that we've got. So the numbers will change, and as we get information from provider partners in terms of the funding arrangements and what's coming from Scottish Government. So the numbers will change as we go through this. Yeah, so that's probably the best. But if there's something specific that you want to pick up on, Bob, then I'm happy to take up off our table if you want, or we can look at it further.
I think it will be the demand. It will be demand on services.
Yeah. So there is absolute recognition in terms of demographic demand. One thing at the moment in terms of demographic demand, we are waiting on some national information, fresh information coming through in terms of that population growth. There was information that was published, but it takes into account the COVID period, and we now need that post-COVID revised future look information from a national perspective to more accurately and better guide us. So our information just now is based on probably assumptions that are perhaps outdated, and we do need that better look going forward, but we don't have that information to hand from a national perspective to make a better assessment of where we think it's going to be going.
Thank you. I'll bring in Dorothy next, followed by Raymond Marshall.
Chair, Colleen, indicate that she wishes to speak.
Oh, sorry. Sorry. I'll go to Colleen first, if you don't mind, Dorothy.
Thanks, Ken. Sorry, I'm taking away the back of the room here.
That's all right. Sorry, perhaps my eyesight's not helping.
No, you're fine. Firstly, I would just like to echo and applaud the efforts of the entire team that have brought this budget together. You can see the real scale of the work that's gone into it, from the impact assessments and everything that's included there. Also, I appreciate that the budget consultation was a first attempt here, and I think that there was some real positives to take from it. There's obviously some learning as well, but I really think that it was a chance for the public's views to be heard, and it has impacted some of the decisions coming to today. My real questions that I have are around the palliative care proposals. So I just can't particularly find that there's strong evidence to suggest that there is a current surplus of beds here and that this review is justified. I mean, I do understand that I've seen the calculated suggested bed occupancy rates. So we've got between 70 and 84% for Roxburgh House and about 76% for Cornhill. And yet, in regard to Roxburgh House, with these figures, still 33% of people, which was 48 individuals, actually still died in Ninewells in an acute hospital setting, which is just not appropriate for any life care. I'm sure we can all agree, as a result of there being no beds available there, as in it was at capacity. And I can see when you're looking at the numbers between 70 to 84%, it's not particularly indicative of a day-to-day picture. These places can be at 100% capacity for quite a lot of the time, but when you average it out, it doesn't impact the data in a similar way. And I've spoken with several clinicians as recently as yesterday who say that there is still issues in that they often try to refer patients to Roxburgh or to Cornhill and they cannot get beds that they have capacity. So I have some concerns as to where the basis of this review is coming from. I also don't know, so we've got it down as £100,000 potential saving, and yet the funding for the post of the individual who's going to be undertaking the review is an 18-month contract at £115,000 for the 18 months. So I'm not really seeing the balance there in the savings coming through. I also have concerns that I understand it's fantastic that there's 4 advanced practice community nurses which have now been put in place or are going to be in Dundee, but we still have to think about huge populations in Angus and Perth and Kinross within this, that there's nothing currently in place if we were to think about scaling back these services. Also, just from my understanding, I might be misunderstanding this, but is this issue coming to the IJB for decision for the review to take place? And if so, it states that recruitment for the post of the project manager to review this is at advanced stages, but how can it be at advanced stages if the review has not been approved by the IJB?
I think that's a fair point, and yeah, it has to be agreed also by Angus and Perth and Kinross. There's quite a few questions in there. I did notice Angela's hand was up, but has gone back down. Who is best pleased to respond to Colleen's questions? Dave.
Okay, so I can just come. I'll come in. So bring Angie in a second. So there's a couple of things for me in terms of general response. So in terms of the value of the savings, so £100,000 that's been kind of put in the saving, that's like a part year effect, because that's what we anticipate might be kind of freed up within 25-26 from that. Now, at the moment, we still have to kind of work through what that kind of actual kind of full year delivery might be. So there is something around that, and the investment is not just about releasing the kind of funding; it's also about the kind of quality of service and kind of quality of care for end of life that can be provided. I'll bring it up to you to kind of cover a bit further. But in terms of the model that we have within Tayside, the model needs to be reviewed and updated, because I think in comparison to other models, it's not kind of no longer fit for purpose in terms of the kind of scale of the sort of balance between community based palliative care and the sort of the inpatient kind of bed base that's within there. So I'll let Angie comment and explain that a bit further. And in terms of the kind of timing between the post and the kind of review, we actually did agree as an IJB back in, I think it was August of 2024, to commit to transformation funding and to commence a kind of service review of palliative care. So that sort of that kind of element has kind of almost like started in terms of the service review. We've kind of expanded it further because or a proposal to expand it further on the basis that there's also a kind of an NHS Tayside kind of move around and developing a palliative care strategy for Tayside, and that post will kind of help can support with around that. So, Angie, do you want to come in and add anything?
Thanks, Dave. Thanks, Chair. Yeah, there's a few things to kind of unpick in there, and apologies, Colleen, if I miss any of the bits. So, at the moment, as Dave says, we already have approval from the IJB to start this review, which is why we got that transformation funding. Our colleagues in P&K and Angus are very, very keen to do the same exercise. So they're already involved in terms of a day of care audit, which is something that we would do under operational matters anyway, to make sure we were being as efficient as possible. This is very much about shifting the balance of care. So people tell us they want to die at home. The challenge that they have is around making sure that they are as pain-free as possible and their symptoms are under control. Some of the work that we've done around advanced practice nurses, that has been underway for about a 3-year period now, and we now have 4 in place in Dundee. Angus have a similar model, and I believe P&K have something similar as well, but we all work in slightly different ways. So although this paper is about the Dundee budget position, there is very clear links with both IJBs in Angus and P&K to try and make sure that this is a whole system, not just across the 3 partnerships, but we're also involving, going forward from this point, it'll be the whole system in terms of acute, paediatric, community services, third sector services. We're trying to make sure that we map that out effectively so that we know where the gaps are. So these people who want to die at home that can't currently do that will be able to do in future. And as Dave says, it's about making sure we keep that quality of care element in there. It is a bit difficult when we've had to bring a budget paper that is slightly discongruous with the strategic aim, but we do have to take into account the financial implications of all of this as well. And we believe that if we get this model right, that will result in those savings across the piece. But we still need to do this review and make sure that clinically this is sound before we can make any final recommendations to all 3 IJBs. In terms of the acute services struggling to get admissions, we wanted to be very transparent in this paper about where we're at right now. And one of those things was about the people who have died in Ninewells awaiting a bed at Roxburgh. However, I would caveat that with the note that the current average waiting time for those people on that waiting list is 1.5 to 2 days. So there is something that we need to do as part of this review about a deeper dive about where the actually appropriate referrals, should somebody who is that close to death actually be being transferred at all. And we currently have 3 beds in Ninewells that can be used for people in that situation. So it's trying to make sure this review covers all of that at the same time. Apologies if I've missed anything else.
No, not at all. Thank you very much for that. Can I just come back with a little, saying, you know, there's the average, averaging about 1.5 to 2 day wait. I would suggest, with my nursing background and having had to nurse palliative patients within a very busy ward segment, that having 48 hours in a ward setting compared to a palliative specialist care unit is very different, and I would say should always be aiming that as soon as there is a decision made that a patient is palliative, that they should be getting specialist services, that we shouldn't be nursing these patients in an acute setting if that's possible. So I still feel that 2 day wait is quite long, and these referrals would still be appropriate for this person that's 48 hours. I appreciate that this is maybe before I joined the IJB that this decision had been made, so I wasn't aware of that, so sorry about that. So today we are deciding on the expansion of this previous decision, is that correct? The expansion of the review, or?
So, Chair, can I just go in? So,
Yes,
in terms of the recommendations on that particular report, we are kind of noting the progress that's already been made to date. And in terms of the saving, we're approving that to set a value of 100,000 against that saving. Now, again, we will continue to monitor progress around whether that is going to be feasible as the review is undertaken, and then remitting to myself as Chief Officer to bring a further report on an update in terms of where we're at with that. So we're not kind of asking to do the review because we're not in effect on the.
Thank you very much. Thank you.
Yeah, thanks for these detailed responses. I hope you're relatively assured by that. I notice I might bring in Susanna Brown next, if that's all right, given that you're a registered medical practitioner. I'm assuming, obviously, I'm assuming you want to comment on this particular issue. It may be a different one.
No, thank you, Chair. It is the same. And just thank you, Colleen, for your comments there. Just agreement with you around that end of life stage in palliative care and being in the right place. I just really wanted to draw attention, and David did mention it there, around the Scottish Palliative Care strategy that will be released in the summer. It's due to come out, and I think part of this review, we absolutely have to be clear around the recommendations within that strategy, that we're aligning the review alongside this. I think that's really important, that we pick up on that, given we're approaching this as a whole system. I think we just cannot forget and shouldn't, we need to be cognizant around specialist palliative care and end of life. And I guess just to pick up on some of the comments in the consultation around, was the data absolutely accurate around the bed usage? So I think I just wanted to draw attention to that, the fact that people have commented on that, and that we must not forget that people will still need end-of-life care, palliative care within a specialist area. Thank you.
Thanks very much. So I'll move on to Dorothy, followed by Raymond. Sorry, you've had to wait, both of you. Anyway,
that's okay. Christine spoke about the work leading up to the preparation and presentation of this budget, and I just want to say, first of all, I'm really grateful for the efforts made by Dave, Christine and Catherine for IJ to lead the IJB members through the budget process. I thought that was very, very useful, the development sessions that we had. A quick comment on the consultation as well. I did have some concerns around the consultation that I expressed at the last development session, but that doesn't take away from the huge amount of work, good work, that was done to produce this consultation, in a short space of time, and to analyse the results and give us the report on the results. So, again, well done to the team that has done all this preparation work to bring us to this stage. I'm really grateful. I wanted to draw attention to item 4.5.2 in the report. And this highlights the significant overspend on care at home packages during 24-25. And it tells...
Well, you've just gone on to mute there, Dorothy. That's it.
Sorry.
Yeah. It's all right.
This tells us that the additional budget investment reflects demand growth and the need to meet and maintain delayed discharge targets and remove unmet need in the community. So, additional investment led to meeting preset targets and removing unmet need. That's good. But it also had the effect of adding to the overspend on budget at the year end, resulting in a clawback on these resources for the coming year that will have negative impacts on frail older people. So my concern here is that we were so busy congratulating ourselves for meeting our delayed discharge targets and removing unmet need in the community that we took our eye off the ball in terms of the very real risk this additional spending posed further down the line. I'm not convinced this risk was highlighted sufficiently to board members, but I'm happy to be proved wrong here. But as someone who tries very hard to absorb all the information presented to me, I would appreciate officers' comments on how board members can be better alerted to any downside associated with success in service delivery.
Yeah, I'll bring in Dave to respond to that. But yeah, your point about the consultation, what really impressed me was the amount of material that came out of that consultation, which was only, it was 15 days, a relatively short consultation, and the amount of work that went in, giving us some meaningful information out of that. And next year, I think we'll be allowing more time for that consultation to take place. But yeah, good work, and it's been really useful as part of this process. Dave, can I bring you in on the issue of the care at home hours? And I do share Dorothy's concern that we have been patting ourselves on the back, and actually it's the staff we should be patting on the back that are providing that care at home. But everyone's been getting a pat on the back about how well we have been doing in terms of delayed discharge, getting people out of hospital that don't want and need to be there. So there is a concern, given that although we are 3,000 hours up on last year's, what we budgeted for last year, it's still 2,000 hours down on what we have recently been providing. So if you could comment on that, please.
Yes, certainly.
Yeah.
Thanks, Councillor, for the question there. So, in terms of the budget preparation for 24-25, we did enhance the kind of budget for care at home on the basis of what we anticipated the demographic growth to be over the course of 24-25. And as Christine kind of alluded to earlier, in terms of a response to Bob's question around the demographic growth, we don't have the kind of most up-to-date information, or we don't have the most up-to-date information on the kind of population health. What we've kind of then seen is obviously a significant increase in demand, much higher than we anticipated that we would see over the course of 24-25, and that has, and with that demand coupled with that kind of Scottish Government push and kind of local push to kind of ensure that we reduce delayed discharge, kind of led us to that kind of pretty quickly kind of rising to a position of being kind of 5,000 hours a week over our kind of budget and resources. In terms of kind of the highlighting that particular area of concern, the first financial monitoring report that the IJB receives each year is the August, or kind of the one that gets kind of has the most information is what's presented in August. And at that point, we kind of raised the issue of the fact that our system was overheating financially as a result of that kind of surge in demand, which then led to us moving into financial recovery mode over the course of most of 24 and 25. So we were relatively fortunate in one sense, because we actually did have some level of financial reserves available to us in the current financial year, that increased cost and increase in demand could be met from reserves over the course of 24-25, and indeed the kind of latest financial position that Christine's presenting is kind of showing that we've kind of indeed kind of kept within that kind of balance of reserves, in fact potentially even having kind of slightly more reserves available to us for 25-26. Now, whether we can kind of review and kind of discuss with members around how that kind of message was maybe not kind of fully received in terms of that connection between the performance around delayed discharge and the increased cost of what that actually meant to us in terms of our financial risk that kind of sits within the system. So, in terms of there's maybe a bit of reflection there in terms of, so what was that kind of message and how did it land, and kind of they can do that. But hopefully we're not in that position in the future, to be honest, that we're presenting so early in the financial year with a kind of different financial position we've set within the budget. So hopefully that kind of helps respond to that, Council. Jerry,
Sorry, it's the first time I put it on mute during the meeting. Raymond, you for a lengthy wait. Sorry about that. I can bring you in now, though.
Thanks very much, Chair. My questions are on basically around Appendix 2, and I'm looking for some reassurances, particularly probably from Dave or Christine, around the risk of being able to deliver on these efficiencies, because what I see, I think, is a double counting or a saving from the same pot. So, for instance, removal of the long-term vacant posts. So the funding that was based around that, my understanding is that would have been used to offset some of the savings, but also supplementary staffing. We then go into reduction in supplementary staffing spend, which is an additional 3% on top of the removal of that. So therefore, to me, there's a risk there about being able to deliver on that, particularly when you add in again the admin support review and note 11, which is the further. So not only just on top of the removal of the posts, but and then on top of the 3% target, there's a further 1.5% operational efficiency, which mentions recruitment again. So therefore, that's another additional percentage saving on top of the staff. And my other question was, you've got a management staff turnover, a management review. Is there a percentage against that, and is that not the same efficiency savings that you're making around staffing? So all these point to the same pot. I'm really concerned. So what is the risk of you actually being able to deliver these and potentially double counting in relation to what you're trying to save on? Thanks, Chair.
Thank you. Dave, can you come in on that, please, or Christine? Maybe.
I'll come in on that to start with, and Christine kind of comment with anything else. So yeah, I absolutely kind of recognise there is a real challenge around that. As kind of Raymond says, what we are kind of mindful of is that yes, so if you take the 1.3 million in terms of the long-term vacant post, that is something that is almost like almost embedded in our kind of our budget at the moment, and we've kind of seen consistently kind of year on year that we can't fully recruit to every kind of post for 365 days of the year. So there's that kind of recognition. There's a number of posts within that that we've just never been able to fill. So you know that's the kind of the management sort of kind of proposal around how we then look to do that. In terms of the reduction in supplementary staff and spend, that's kind of a number of different things that need to kind of be at play there. So that includes things like looking at the current absence levels and supporting staff to kind of either come back to work or to stop staff kind of going off, and where that's kind of possible as well. All that kind of for a number of our services where there's a kind of direct kind of cover required. We kind of see that sort of kind of reduction in our kind of spend position, and the need to kind of bring in more costly kind of cover arrangements around that. And absolutely, the kind of 1.5% of operational efficiency target is a big challenge, because it is, as you say, kind of overlaying what we're already doing. So everything else that we're kind of looking to reduce will be subject to kind of further reduction. As Christine has kind of indicated earlier, that kind of figure of given the shift from NHS side to kind of provide that 40% balance of national insurance kind of contributions, that does kind of ease the pressure on that element by what's just under about 600,000, 670,000. So still a significant target to make. From a management perspective, we'll continue to kind of review impact and review the kind of deliverability of these savings as we kind of work our way through the year. As you know, Ray, we've got different fora within our kind of governance structure, such as our kind of local partnership forum, to kind of discuss impact and what that's looking like. So if there are any issues that have emerged throughout the year, we'll be reporting them back through the IJB. And what we'll do in terms of our financial monitoring reports going forward into 25-26, and we'll be kind of putting red, amber, green kind of status against each of the savings and reporting on the savings as they're delivered. I think the other thing missed was about the management side of things. So there's kind of £500,000 in as a review of management structure. So we have got a management structure agreed. We don't have all the posts actually kind of recruited to. So my intention is that we kind of have a further review just now to see what can possibly be kind of freed up in terms of management kind of oversight around our structure. So I don't know, Chris, if there's anything you want to add to that.
Yeah, it's just the £1.3 million in terms of long-term vacancies. It's actually a non-recurring saving that we've got in place in the current financial year, so it is just making it permanent. It's just shifting that, putting that back in. We recognised previously in the report that that we were relying on non-recurring so far. So that's not actually in most of those that budget is not actually in sort of current year position, and budgets are managing with that taken out. And probably some of the supplementary staffing. There's proactive ways of our managers and budget holders looking at this in terms of what's the most cost, if they do need to bring supplementary, what's the most cost effective in trying to avoid expensive agency and maybe sort of double the costs for agency compared to sort of core recruited staff, but also through sort of proactive recruitment proposals as well, and recognising that actually we do want permanent staff in place, and we do want to be looking at this and in terms of supporting our staff back to work and through health and wellbeing. So it all kind of links into that, to actually support the staff that we do have in place, so that we are not relying on expensive supplementary staffing and having a premium for that. But yes, it will be a very challenging situation for our teams to be able to deliver, particularly the additional 1.5 operational bar. If we can bring that down, get confirmation, bring that down to 1.2%.
You happy with that response, Raymond? Yeah, thank you. David Cheap is up next.
Thanks, Ken. And as we're taking sort of questions and putting some comments across all the papers here, if you just bear with me, my share, I think it's actually good in that other members that have spoken already this morning are asking questions that I would have, so there's some sort of commonality across people's understanding of where the key concerns are. I'd just like to reiterate my thanks to everybody and the key officers here on their efforts in the months leading up to this, and certainly the workshops have been a huge success, I think, in clarifying people's understandings of the pressures and concerns here. So thanks again for that. Just before I move on to one or two questions, can I just say, looking at the across all the appendices and the main areas where we're considering efficiencies and savings, the quality of the impact assessments that have been put in there against each of these is very impressive, really. People tend to all deny or skip over impact assessments, but compared to some I've seen through my council life and across other integrated joint boards, the quality of them in Dundee's integrated joint boards really is worthy of note, and particularly in this budget paper, I think some people will agree. If I can move to questions, and without putting senior officers feel like they're on question time, I've got two or three that I'd like to bring up. And I think Dorothy already mentioned about the reduction in hours in 4.5.3, and yeah, we've seen this year 5,000 additional hours over budget here, and we're in the budget we're this year we're looking at 3,000. My first question really was, with that, just for a surety, the reduction of that 2,000 hours per week, can this be managed without impacting care? That's a very simple question, but I think that's the one that matters to me. So that's my first one. I think Raymond just mentioned as well inefficiencies in note 11, the 1.5% operational efficiencies. Now, that's a chunky number, to bring in £3 million. And my question really, there's a lot riding on that clearly. And my question really here is, accept that figure, but it's a non-recurring proposal, and I would have thought that we're bringing operational efficiencies. We'd like to see them as being recurring savings going forward, because we'll have clearly added pressures in 627 and going forward. So we need to see more recurring efficiencies. The third one, the transformation reserve as well. Bit of a concern with that, because in the budget where we've put in £1.5 million being diverted away from the transformation reserve back to support the budget, it leaves only what was originally, I think, a £3 million figure, whatever, but it's going to only leave £780,000 excuse me, in the transformation reserve. And just wondering how much that will impact on the pace of transformation, and wondering if it's not, by taking that out of the transformation reserve, is it not in conflict with one of our key things that I started the meeting with, saying about the importance of preventive measures and early intervention, because that's what the transformation reserve, I think, was really there to do, is to drive all of that, to drive improvements in efficiency. So it's just a comment, but I know we have to find money from places, and reserves will get poached to do that. There's a lot of that happening anyway, but I wonder whether the transformation reserve was one of the places to do that, for that to come from. I think my only other question was in the appendix on third-party commission services, here where we've shown 8 organisations being chosen to seek £382,000 of savings, and yet the paper refers to a further £618,000 of further savings to be made. And my question really is, again, that's obviously rolls up into £1 million exactly of savings. And I'd like to just know where the 618,000 additional is going to be targeted. So a few questions there, Ken. Apologies, but yeah, sure, I'm going to sit back with that. There's 3 or 4 questions, but they're hopefully each of, whether it's Dave or Christine, Angie or Catherine, can answer these in turn. That'd be helpful. Thank you.
Yeah, I share your concerns about every point you've made. None of these are savings we would have wanted to make. Dave, are you in a position to respond to the detail of David's questions?
Well, yeah, I'll start, and colleagues can comment as well. So going back to the kind of first question around the kind of the care at home and reduction in the number of hours there. So just to guarantee that anybody who has a service just now won't have that service taken away from them. So it is about kind of how we manage new demand. There's a couple of elements of this in terms of the care. Some of it is around better efficiencies with our kind of third sector providers, or commission service providers, in terms of how we manage the contracts around care, and ensuring we're going to get the best value of that arrangement. And we've got a new framework agreement coming in place kind of shortly around our kind of care at home services. So it's not a case of anybody who has kind of services just now will have them kind of withdrawn from them. The only thing that would happen is as part of the kind of normal kind of assessment process anyway. So kind of post-hospital discharge, if somebody's got back care package in and then has been re-enabled back into the community and doesn't no longer need the package. So, but what we'll be kind of looking at is there's kind of many mitigations as we can around kind of options for alternative supports if available. In terms of the kind of operational efficiencies element, so yeah, take your point, we've kind of noted that down as non-recurring, and we've kind of put that down as non-recurring because it is in effect the balancing figure that we've had to kind of put in, and it's about that confidence of how much of that we can deliver on a kind of recurring basis. But we're kind of still looking at the mechanism by which we're going to be able to deliver on those operational efficiencies going forward. But again, we can review that over the course of 25-26 in terms of our confidence around deliverability of that side of things. In terms of transformation reserve, again, I'm going to agree with you in terms of it's not necessarily the right thing to do to kind of just start that transformation reserve. It gives it a little bit of flexibility, but not as much as we would want to have. I think the key thing for me is how we then kind of use both the local authority and the DH&SCP side the transformation reserve, so transformation funding, to be able to kind of help support our health and social care services as well. So there's always a case of, we've got this three sources of funding for transformation. It should be open to us as partnerships. And again, we've kind of spoken to our partner bodies around us being able to kind of get equal access to those. But again, as Ken has said, previously, I think there's most of the things on this list of things that we would want to be doing, and also kind of counterintuitive to what kind of works around that. And finally, we'll bring anybody else in. Third sector commission services. So the 8 organisations that we've identified so far has been kind of following a kind of first review of our commission services, and we've kind of looked to see, well, what we commissioned, where there might be potential duplication of commission services, and looking at some sort of elements around prioritisation of the resource that we've got. So there's a part year effect of that again, because we have committed to, where appropriate, provide the 3 months notice period for changes to contracts. So to support any sort of kind of restructure or kind of redundancy, etc., that may be required from each of these organisations. In terms of the balance, and so again, noting the risk and the balance of the significance of that, that's to kind of be undertaken by some wider views that will have a bit more time to kind of to undertake, and we'll kind of cover some areas that, again, working in partnership with our partner bodies, we may see that there might be some efficiencies or kind of duplication around, if we're kind of getting more into some of the collaborative work that we're looking to undertake. But again, acknowledging it's still a kind of challenge, and again, can point back to our financial reporting and year, and kind of flagging up early if we think this is going to be a kind of risk of delivery to the kind of financial position of the IJB. I see Angie's got a hand up, so I'll let Angie come in and see if Christine wants to add anything.
Thank you. Yeah, it was just to add to what you said, Dave, around the care at home. So now that we've completed the analogue to digital transformation, there is a significant amount of health and social care technology that we need to start looking at to not to replace human beings, but to actually help people stay that little bit more independent for a little bit longer, which will help take some pressure off of the system. We also recently introduced single-handed care for quite a significant number of individuals where it was safe to do so and appropriate, but that's only been rolled out, I think, to 3 providers so far, so there's still a significant piece of work to continue that work. And the third part that we're doing is the preventative work, using the downtime that now that we're paying full shift costs, because that has been really, really successful in helping to keep people out of hospital, for, helping people to get home quicker, and doing some of that preventative work in terms of exercise programs, etc., to again keep people independent for longer. We're starting to see some of the benefits from that, but we're probably about 1 year into a 2-year program before we fully understand how much of an impact that will have on reducing that 2,000 hours without any impact on the system. One thing we will be doing going forward is trying to protect where possible the hospital discharge element that sits very much within the 2 highest categories within our triage system. So it's likely to be people with lower level supports in the community that are most impacted by any changes, and that does unfortunately include carers. But again, we're looking very carefully at how that impacts at each stage as we go.
Thanks, Angie. Chair, just bring in Christine, and I think Catherine's
hands up. Yeah.
Probably not enough for me to add. Dave's covered most of it, and Angie's covered a couple of other points that I was going to add into it as well. Just in terms of one of the things, in terms of financial implications of care at home, when we did recognise that the challenge was there back in August, and that financial overspend was coming through, we can look back at the growth in terms of the spend that we'd got to up to sort of the summertime, and that recognition of the demand that was coming through and what we were actually paying for, and then all the things that we've been putting in since August, September time to manage this efficiently and effectively and make sure that our contracts and our spend was used efficiently. We've kind of plateaued the spend level, but we've continued to manage the demand that's been coming through. So and that to me is indicating our financial recovery actions here, our efficiency actions that we've done, minimising sort of the downtime, looking at the best use of the resources that we've got. We know that we need to be making sure it's not providers that are demand manage demand within the kind of resources that we've got, but also our services as well. So that'll be looked at as well through it. And the aspect of the operational efficiency target being non-recurring, as Dave said, this at the moment is a bit of a balancing entry. I'm hoping to be able to bring that down if we get confirmation of additional funding, if we get that written confirmation of that, bringing that down. But recognising that's going to be really challenging, and therefore, if we recognise things that actually do become permanent, do become recurring efficiencies, then we will look to bring that back as the next year's budget process. But you know, it's some of the things might just need to be sort of short-term, non-recurring initiatives that managers are doing just now, while putting in longer-term plans that we bring back. So that's, but yeah, recognise that that's the fact that we are relying on non-recurring to balance the position for 25-26 does leave us with a gap that we need to be planning for, and that planning will start relatively soon for future years in terms of that financial gap as well.
Thanks for these responses. You happy with that, David?
Yeah, absolutely. Thanks for the thoroughness of the replies. Thank you.
I think I'm going to bring in Martin. Then after that, we'll probably have a 5-minute break just to allow people to move around, get a tea or whatever. But I'll bring you in, Martin, first. And I've taken a note that Dorothy and Siobhan are the next two speakers. So Martin, then we'll take 5 minutes. Martin.
Thanks, Ken. Just to say, the response from David. David's question actually took a lot of the questions that I was going to ask out, so that's going to shorten my thing quite substantially. I'm just wondering, just to raise on item on the Appendix 7A, the commission, third-party commission services, the reductions that are happening across those services. My concern is how it's going to impact on carers, because a lot of carers use these third-party commission services rather than statutory services, and there's going to be a bigger impact on them. I think we need to, I know it's in the impact assessment, but I think there needs to be a more in-depth look at how a lot of these reductions, these cuts, these savings that we're making across all services is going to impact on carers, and I think that would be advantageous at not at a short stage, but at a later stage within the process for the next budget, that we have some sort of dedicated paper on how these impacts, how these savings, how these efficiencies are going to impact on carers. And I also like to echo the comments made earlier regarding the work that Christine and others have done in producing such an excellent report. And I also like to thank Catherine for the consultation paperwork. There's a lot of questions still to be answered. There's a lot of data still to be extracted from that. And it's still something that we are going to be looking quite in depth at that over the next year. Thank you.
Thank you, Martin. It's now 11:18. Could we come back at 11:25, please? And as I say, I've taken a note of the next two questioners. Thank you. So that's it's 11:25. By the way, Martin, if you are back with us, I'm not sure he is. I shouldn't have cut straight to the break. I shouldn't have cut straight to the break there without. I know you said that a lot of your questions were answered, but I shouldn't have cut to the break without seeing if any of the officers wanted to respond to the points that you made. Yeah, Dave.
Yeah, no, so I'll just kind of come back in on Matt's points. So kind of happy to kind of put that up further in terms of, you know, back to the main lessons learned from this kind of process. If there's something that we need to, we think we need to do kind of further to kind of enhance that impact, particularly groups, then kind of happy to take that forward.
Thank you. Happy with that, Martin? Yeah.
I'm quite happy. Thank you.
So next is Dorothy, then Siobhan. Dorothy.
Thanks, Ken. I think I've probably forgotten what was my burning question before the break, but hey ho. And I did want to echo David's comments about the impact assessments. I've said this before at board meetings, but congratulations to Catherine again. Excellent impact assessments. I do hope that board members have taken the time to go through these comprehensive documents. You know, they give us a real flavour of the implications of the decisions that we're being called on to make today. I think one of the points I wanted to raise was somebody spoke about, I think it was Dave, used the term counterintuitive, and that certainly resonated with me, because reducing investment in transformation work and demographic pressures is certainly counterintuitive, considering the key messages in the Accounts Commission report that we discussed earlier, around working better with partners to redesign for efficiency. We know that our population is ageing. Christine mentioned that, you know, our information was a wee bit out of date and we're waiting for a further update, but we all know our population is ageing across Scotland, and Dundee will be no different. So there is increasing demand, and I'm increasingly concerned that we are reducing investment in demographic pressures and transformation services. So that's not really a question, that's a comment.
I think it's a fair point, Dorothy. Siobhan, please.
Thanks very much. A comment and maybe a question, actually. I want to just discuss a little bit the third party commission services. I know that we're in crisis, and I think at times like this, decisions become extraordinarily difficult, and every cut is deeply painful. I am looking at and I suppose that brings on the kind of the theme of counterintuition as well. That I'm looking at the cuts to some of the third-party services. I'm looking at the Dundee Carers Centre. Martin had mentioned the impact on carers earlier on as well. The third sector is kind of separate, but it's not. It does a lot of the work, as we all know. It does a lot of the work of the Health and Social Care Partnership. And I think maybe where the counterintuitive comes in here is that those cuts will eventually come back to the Health and Social Care Partnership, because the third sector is already extraordinarily financially stretched. The national insurance is just another kind of difficulty that they have to incur. The pressures on the services are extraordinarily. The Dundee Carers Centre is a good example. They're dealing with primary school carers now, so there is a real sense of vulnerability there. But I suppose my point is there is a risk assessment here. And the risk is, of course, that it will be extraordinarily difficult for some of these services to survive. But there is a longer-term risk assessment to the Health and Social Care Partnership in general, in terms of the impact that those cuts will have, because it will be the Health and Social Care Partnership that have to deal with those as the situation becomes worse, as people's health becomes worse, as people's mental health becomes worse. That there's not a question as such, but I suppose maybe what I'm asking is that we take great care over the next few years to consider the impact and see if we can kind of find a strategy that would allow the third sector to survive and perhaps even thrive should situations improve.
Yep. Does anyone want to come in on that point? I mean, again, I'm agreeing with you. I'm going to be in the position shortly of recommending that we accept a budget that I've got great misgivings about, for the reasons that you've mentioned, Siobhan, for the reasons that Dorothy has mentioned, that many others have mentioned this morning. It's a very difficult position to be in.
Sorry, I should have said that, you know, there's no blame here, and I think that the officers have done a phenomenal job. Absolutely. And I'm pretty sure they've had sleepless nights as well.
Oh yeah. Well, to be honest, I've been involved in many budget processes in almost 18 years as a councillor, whether they be IJB budgets or the annual council budgets, and this has far and away been the most stressful one. Has definitely affected my sleep pattern. I think I slept 2 hours last night, but this isn't about me. But yeah, difficult position to be in. I don't know if any officers want to come in. I think Siobhan was just really making a point there. And I'll bring in Christina Cooper from DVVA next.
Thanks, Ken. Can you hear me okay? Because I've been
Yes.
having IT issues. Just to really echo the points that Siobhan had made there, I think we know this, the decisions that are being made across the partnership are going to have a significant impact. But one thing that's different here, and I think in relation to the consultation, is all of the officers have met with the TSI and partners, and we've had open and transparent discussions about lessons learned and how we would do things differently moving forward. And the officers have already met with myself and other partners, third sector partners, that are going to be significantly affected, to look at how we redesign services and work together moving forward, so we all do it as a partnership rather than a standalone, because the decisions have been really difficult. So yeah, I just echo what everybody says about the officers. And the one thing here is that, you know, the officers have been completely open and transparent with us. Nothing's been hidden. We've been round the table, and it's difficult for us all, but we will work together, you know, to continue to try and deliver these services and meet the needs of our community.
Yeah, these are very welcome comments, and I'm sure appreciated by the officers who have been part of this very difficult process. At this point now, just let me check. There's no one else in the room. No. Anyone else wishes to make a comment and ask a question before I move to the formal stage with the recommendations? No. Normally I kind of summarise the recommendations, but given this is the budget meeting and it's so significant, I'll just read them out in full and then ask for your agreement. So the recommendations state that recommend that the Integration Joint Board notes the implications of the proposed delegated budget to Dundee Integration Joint Board from Dundee City Council and indicative delegated budget from Tayside NHS Board for 2025 to 26 as set out in sections 4.2 and 4.4 of this report. It's further recommended that the IJB accepts the delegated budget proposed by Dundee City Council as set out in section 4.4 on table 5 within this report, instructs the Chief Finance Officer to report back to the IJB following receipt of formal notification from Tayside NHS Board of the budget offer with associated recommendations, including any implications of the finalisation of lead partner budgets on the IJB's net budget position. 2.4 notes the range of estimated cost pressures and funding uplifts anticipated to impact on the IJB's 2025-26 delegated budget. 2.5 notes the results of the IJB budget consultation 2025-26 set out in section 4.10 and appendix 4. 2.6 approves an uplift to staff pay element of adult social care providers' contract value to enable the increased hourly wage payment to staff providing direct care with effect from April 2025 as detailed in 4.6. 2.7 notes the operational efficiencies and management actions detailed in Appendix 2 to this report. 2.8 approves the budget savings and financial support from reserves as summarised in Appendix 3 and detailed in Appendices 6 to 12 to this report. And finally, 2.9 remits to the Chief Officer to issue directions as set out in Section 8 of this report. Are these recommendations agreed?
Agreed.
Dorothy?
Agreed.
Yeah, I see Dorothy's hands up. Dorothy?
Thanks, Ken.
Yep.
No, I can't agree to approve these budget cuts. The proposal will remove over 2 million of demographic growth investment and over 2 million reduction in this year's level of care at home provision compared to last year, and a further over £3 million of operational facilities, that is cuts to services. Each and all of these measures will adversely impact on some of the most vulnerable groups in our city. Combined, they pose, to me, an unacceptable level of real harm to our communities, particularly to our growing population of frail older people. I can't support passing these cuts, and in doing so, I urge the Chair, in consultation with the Chief Officer and the Chief Finance Officer, to request an urgent formal meeting with the Scottish Government Finance Secretary for Health and Social Care to request an uplift in funding, and initiate urgent formal discussions with NHST side to explore a release of resources through the large hospital set-aside mechanism in recognition of Dundee Integration Joint Board's performance in reducing delayed discharges during 24-25.
Thank you for that, Dorothy. I think I would like to check with Mr. Roger Menny at this point, if that's okay, Roger. I'm wondering, whilst I'm happy to accept Dorothy's dissent from this, given the need for us today to agree a balanced budget, would Dorothy have to provide alternative proposals for us to be able to continue operating within budget, is my question. Without wanting to silence Dorothy in any way, that's my question.
Sorry, Ken, could I just say I would abstain from any vote?
Okay, that's a different, an abstention, I think. I mean, Roger, you can come in if you want, but I think that kind of answers my question. Abstention's a different matter, Roger.
As members of the IJB will aware, there are 6 voting members of the IJB, and that is not 4 of the IJB pass on a simple majority vote. As I understand the proceedings so far, we have 5 voting members who are prepared to support the recommendations in the report, and Councillor McHugh, who wishes to abstain. Given that there's no formal amendment before the meeting, I would suggest that we note that the recommendations have been approved. Councillor McHugh second.
Yeah, absolutely. Okay, thanks for that. And so, yeah, we'll record that as an abstention, Dorothy. With regard to the other points that you've made, I've already been in contact with officials of the Scottish Government. I know that the Leader of the Council, who's also a member of NHST side board, has had a number of discussions with government about funding for the IJB. But I think it'd be best to discuss this with you off table. And in the meantime, happy to record your abstention. Is that okay? Thank you. And thanks everyone for, well, actually, we still have the next item. Shouldn't have dropped it on the floor. Arlene, yeah.
So that takes us on to item 5, which is meetings of the Integration Joint Board attendances, which are for information and record purposes. And item 6, which is the date of the next meeting. The meeting will be held remotely on Wednesday, the 16th of April.
Okay, thanks everyone for your time today, and not only today, because the budget setting process hasn't just been about getting presented with a wad of papers that you didn't have sight of before. This is a process that we've been working at throughout the last several months, and a process which I'm sure we're all looking forward to engaging in again for next year's budget. So yeah, thanks everyone from the heart. Okay.
Thank you, Ken. Chair.
Bye.